Deja, and I'm going to be showing you how to place an intravenous catheter. She's getting a dental today. So first I'm going to start out by clipping a square area here. It's okay, girlie. Just careful to keep it slow and controlled, because sometimes it can be a little scary for them. And I also want it to make it look nice too. Trim a little more here. Good girlie. All right. Place that. Whoop. Looks like that's just a little. Okay. All right, girlfriend. So I'm gonna get my preps here. I'm gonna do 3 preps. Here. So we're gonna start. Oh shoot. Do a rough scrub. I wonder if I should be wearing gloves for this because they're requiring me to do 3.
Go ahead.
Okay, I'll just keep going.
There's gloves right there.
Alright. Okay. And then I'm just gonna put some gloves on for the final scrub. The rough scrub. And what I'm gonna do is start here, go out, careful not to go back on any of the areas that I went to, so I'm gonna do one more prep, go in a circle outwards, and do one more. Move these out of the way. All right, now I'm gonna take my gloves off just so I can place this catheter a little easier. So I'm using a 22 gauge on her. I'm just gonna open it up a little bit here, set that down, and then I'm going to place this here so to prevent any of the hair from contaminating or from blood. Oh my gosh. Okay, I gotta open another catheter because I just dropped that one. So, all right, we'll try that again. So, open it up like this. All right, girlfriend. Okay, I got my line, I got my tape. So, I'm gonna open this up here. Looking at her vein. And then I'm gonna place it bevel up. It's okay, honey. Okay, I'm getting a flash. I'm going to advance the rest. Okay. Put that cap on it. I'm going to move this out of the way here. And then I'm going to grab my, tape. Move this out of the way. Take that really good. Kelly's doing a great job in holding it. Take it once here. Take that again, just like that. Okay. Now I'm just going to check to make sure that it's running before I finish. Placing it, because I want to make sure that it's actually going to work. I'm just going to move that. Thanks, Kelly. Okay, so I'm just going to open the line here. And it's running right there. When I occlude the vein, it stops. Now it's running again. Checking it again. Now it stops. Okay.
You can take your bag and drop it and see.
Okay. Okay. So I'm just going to place a piece of tape like this, just to secure this into place, just to get that extra, and then put this here so then she doesn't yank it off of her if she needs fluids after surgery. And then I'm just going to place a piece of vet wrap on there. Cover that up. All right, and she's all set.
Okay, so I just wanted to do a little bit of discussion after I placed Deja's catheter. So some of the things you have to be careful about when you are placing a catheter is infection or sepsis if the area isn't properly sterilized when you're placing the catheter in. Second, you can get an air embolism if you're not careful when you're attaching a fluid line to the T-set, because if there's air in the line, you could be giving that to the animal, which could be potentially dangerous. Also, a thrombophlebitis as well as thrombosis can happen in the leg that the catheter is placed. Some things to look out for when you do have the catheter in place are fat foot, or the foot gets swollen and bigger than the other paws, because that means that your tape could be wrapped too tight, so it's kind of cutting off some circulation to their paw, which you don't want to do. So you want to look for heat as well. You want to touch their pad. You want to make sure there isn't any heat or swelling. And also you want to look in their leg if there's accumulation of fluid. Most likely your IV catheter is not in place anymore and it's outside of the vein. Some precautions that you can take to keep your animal from chewing out their catheter. First, Elizabethan collar, a hard or soft collar, depending on or recovery collar, depending on your animal and how they're going to do. We also have the no chew vet wrap, which we use, and that kind of has like a bad taste to it, so if they try to lick or chew at it, it deters them from that. Also, we do carry the bitter apple or the bitter orange spray that you can spray on the vet wrap. That'll keep them from chewing it as well. And lastly, the preferred heparin to sterile saline dilution is 10 or 100 units per milliliter that is used in veterinary medicine.